Hello and welcome to a fresh edition of Talk Therapy brought to you by Driveway Devi. I'm Karthik on behalf of Driveway Devi. As regular watchers and listeners of ours will know, over time we have discussed very many facets and aspects of mental health, from fundamental psychoeducation about conditions and illnesses to more sort of philosophical questions, also targeting specific audience groups. We felt that it was important simultaneously to also address a very important factor in the realm of mental health, which is the education part of it, leading to a potential career in mental health. And I got very, very lucky because when I got in touch with our guest today, she seemed to be the perfect conduit to deliver that knowledge, insight, and information, both from the standpoint of accuracy and the stage and phase she is herself currently at, and the fact that she's a YouTuber herself. So I'm very, very happy and lucky that Dr. Sonanki Deb is joining us. She is a second year psychiatry resident, and we're thrilled to have her. Welcome, Doctor.
Hello, and thank you for such a lovely introduction. I was really enjoying listening to it.
Thank you for being here, and let's get straight into it. Now, please, in your own words, will you share what you're currently doing?
Okay, so I am Dr. Sonanki Deb. I'm currently a second year psychiatry resident. I'm doing my residency from LGBRIMH, Tejpur, that is located in Assam. It is a psychiatry institute. So yeah, that is what 1.5 years is still left. After that, if I successfully complete it, I'll be starting my profession as a psychiatrist. So yeah, that's what is going on currently.
Wonderful. You know, I sometimes joke in private circles that it should become mandatory for each family to have a mental health professional. Tell me, what were some of the reasons you chose to pursue this area of study and work?
Okay, so I actually talked about it in one of the video also. So when I was doing my internship in MBBS, when we are actually posted in all the different departments of medicine, and then when I was working everywhere else, it seemed more or less like a very robotic fashion that what I was told, I was just doing it. But in psychiatry, although it is a very short posting that we have in psychiatry, it's only for 15 days. So
So
you
I'm
need
sorry I'm interrupting you, doctor. Just to get a perspective, when you say a very short posting of 15 days as compared to how long on an average in other streams of medicine?
So, the longest we have is for medicine, surgery, OBG, the main Gs of the medical field. So here you have for a 2.5 month to 3 month postings,
Oh, and then it's just 15 days here. Okay, so
15
that's
days in
quite a bit
psychiatry.
shorter. Hmm.
Yes. And also, like during the MBBS time, there is another 15 days posting there, so you can see the patients. But everyone is very chill at that point of time, so nobody takes those postings seriously. But luckily, when I was posted there, I came across very good cases, and my professors there, they told that these cases are not very commonly seen. So go through it, understand how it's going on. So along with my residents, when I was seeing those cases, I got very interested and also attached to the patients. And that is for the first time I felt like, okay, this is a branch I would like to take up. Then this is like the emotional aspect of it. Then came the practicality of how psychiatry is when and the first thing anyone thinks about is, will I be able to earn money? That
Hmm.
is the only
Naturally.
first thing. So I myself searched a lot of YouTube videos. I talked to my seniors, and in psychiatry, like how we would see in surgery or OBG that you will get attached to a hospital and then you'll start working for the hospital. Those things are a little bit difficult in psychiatry.
Why so?
Here, the because here you have a contractual basis. So if you have 100 patients coming, you'll be paid for that 100 patients, not like a regular salary that you'll
I
be
see.
paid in
Okay.
hospitals. Till date it is like that only in most all the hospitals. But if you want to do private practicing, like if you want to have your own clinic, then the investments are very less. All you need is a couch and a chair, and then you good to go. So I have always been interested in having my own practice. So it kind of gel into it. Ki, okay, this is something I would like to do.
But tell
Uh,
me now that it's come up in context, I'm sorry I'm going on interrupting you.
yes, yes.
Is it, does it make sense for people who are starting out and very seriously considering private practice to do that immediately, or do you gain more legitimacy if you work, with somebody else or with a establishment or a hospital for a certain number of years and then embark on your own private practice?
My personal suggestion would be before going into, see, if you're doing in a government setup, so the type of medication that is used in a government setup is limited to what is being given to us by the government,
Okay.
right? And then when you go into a private setup, the choice of medication kind of changes a bit,
Hmm.
because in government setup the medicines are cheaper
Hmm.
and the chances of side effects are a little higher. So
Hmm.
in those cases we are admitting the patients and we'll observe and then we'll
Hmm.
dispose of the medication. But in private setup you're not able to admit the patient, so you are very choosy in kind of what medication you want to give. And there are some newer medications that have come into the line which are a little bit costlier but have less chances of side effects, so
Hmm.
we would want to go towards that medication. But if you have not practiced beforehand, just starting it yourself in a private setup can be a little tricky.
Hmm.
So what our seniors tell us that always do senior residency. So after
Hmm.
you have completed your PG, you can do senior residency where you are yourself prescribing medications, you're checking the patients, but you're
Hmm.
under a institute, you have your seniors to guide you. So that can, I think, help us out a
That
little
makes
bit.
so much sense. And it's such an important, it's a small but very significant detail I think you've shared. Is it, I have this layman's perception, it may be wrong, which is why I'm asking you. Is it true that the intake of psychiatric patients tends to be more in government hospitals, and in fact, very few private hospitals actually have a serious enough psychiatry department and inpatients of psychiatry?
Yes, I do feel the same. Like if you are going to institutes that are dedicated for mental health and
That's
psychiatry,
a separate issue.
that's so you have a huge number of intake in those cases. Initially when I was doing my MBBS in that college also, the amount of bed allotted to psychiatry is very less compared to what is allotted for other departments. But I think even when I was studying, I saw a gradual increase in the number of beds that were allotted because of the awareness of mental
Hmm.
health and
Hmm.
psychiatric illness that were going on.
And
So
that's
yeah, that
probably also received. I mean, it's a very terrible way of it coming about, but a disaster often leads to certain necessary corrections and developments. I suppose even after COVID, that
definitely.
would have sort of gone up. I'm talking typically about your, what are referred to as multi-speciality private hospitals, where again, in my observation, now I can only speak about Jaipur, that's where I live. I can tell you that amongst the many that are here now, and they're all actually fairly good hospitals, and in fact there's a certain amount of medical tourism that Jaipur has, with people coming in from the rest of the country and indeed abroad, the Middle East, etc. But even amongst these top 7 8 multi-speciality private hospitals, there are only one or two which have a serious enough and dedicated psychiatry wing, and patients getting admitted.
Sure. Even like I am from Noida. Uttar Pradesh. So there also I have not seen growing up. That is one of the question my parents were asking, because we would normally go to private hospitals and they're like, I don't see psychiatrists there. So how will you fetch a job after
Right,
doing that?
right.
So that is there.
Hmm. Okay, so that was that, and I'm sorry I interrupted you. Do you still want to add to some of your reasons for choosing psychiatry?
Yeah, yeah, I think all those that's pros and cons that I think I was going through. Regarding what I mainly thought of was eliminating the other options that were there.
Hmm. Hmm.
So first thing that would a person sees is that a work-life balance.
Sure.
That's important to people. And I think if you choose the major ones like medicine, surgery, OBG, you would have a little bit difficulty in engaging in that concept. And getting into a work life balance would take a lot of time, probably in your
Yes. Yes.
40s at that time.
Correct.
But if you come to non-clinical branches, like you have pathology, you have microbiology, all these things, those you achieve faster. But
Hmm.
another cons of choosing them is that you do not have a direct interaction with your patient. So
Hmm.
that's another thing you want to keep in mind, is whether you want to directly talk to your patients, interact with them, or you don't like that. So I was in the other category that I want to interact with my
Correct.
patients.
Correct. Yeah, that's again a very valid point. Would it also be true to some extent that in spheres and streams such as pathology, where essentially it's a fairly isolated job, and you're certainly not interacting with the patients, that the personnel engaged in these streams and departments also tend to be paid a little less?
I think it depends. I think one of my family members are in pathology, and I think she is doing amazing in that field. So it depends upon which field you are choosing and your capability of working hard.
Of
It can
course,
be
and
in any branch.
I think specifically in pathology, one has countless numbers of examples of then pathologists who've gone on to open their own diagnostic centers, and then we all know what happens then. Now, again, from a layman's perspective, there is this thing called bedside manner. And whenever we go to any doctor, whether it's for a physical ailment or whatever, oftentimes you hear na, that wo to baaton se hi theek kar deta hai, and those kinds of things. And I think that it's fair to say that a lot of how a medical professional handles and gives care and gives advice and goes through that process of consultation has and can have a very embalming effect on the patient, or do the opposite if he or she is a bit abrasive and brash. The reason I'm sharing this context is that, particularly to get into psychiatry and be an effective doctor in that realm, are there any specific personality traits or attributes you feel might be useful?
I think for the personality aspect, mainly what people talk is about is if you are very extroverted or you're introverted, and how you want to interact with the patients. Even I had this thought when I was choosing, but I'll tell from my own perspective that when I am working, I have seen some of my co-PGs being very extroverted and me myself being very introverted. But I think we have our own realm of being how to make the patient comfortable. So if
Right,
you're very extroverted, you will be able to really gel in with the patient, take the information out, what is necessary. But if you're introverted, what helps you is that to be a very good listener. When the patient is saying, you can just sit for very long hours and just listen to what he or she is telling. So I don't think that per se the personality is important, but what is important is, if you are really interested to listen to what the patient is saying. Because unlike other branches, psychiatry, if you're talking to the patient, will take a little bit longer time. Like a medicine doctor will can finish up in 2 to 3
correct,
minutes.
correct.
If you're psychiatrist, you can do that, but just talking a little bit more for like 10 to 15 minutes, then that will be a little bit better for the patient.
That's a very, very valid point. And tell me, because again, in my understanding, a certain amount of flexibility and adaptability would also be perhaps a good idea, because obviously every individual is unique and different. Some clients will prefer the doctor or the psychiatrist to be a certain way, and some others a certain way. So to be able to make that determination and mold your manner to best suit that individual perhaps also is would be helpful. Okay, now let's talk a little bit about the academic part of it. And just in very, very simple, fundamental terms, what is the sort of academic route one takes? When does it even begin? There's always this big thing about whether you would have benefited from psychology studies earlier, as early as possible at school, etc.
So, if you want to enter into the medical field, let's start from there. So, you have to have PCB, that is physics, chemistry, biology in your 11, 12. I had psychology as an extra subject when I was in 11, 12, but that is absolutely not necessary. It was not with the intention that I want to take up psychiatry later on. I had
Hmm,
no idea at that point
right.
of time. So, when you have those three subjects, you will give your NEET UG after your 12th. So, all these three subjects will be tested. Then,
And
NEET UG.
I'm sorry, this is necessarily, pardon my ignorance. I'm
Yes,
somebody who naturally deflects from sciences. So I have zero knowledge. It's PCB, and obviously, N is also necessary, right?
maths.
Hmm.
No, no, it's not necessary.
Okay. But don't
Yeah, it
most people end up taking it?
yes, they do because most of the schools are not offering just PCM or PCB. That's why they
Ah,
take up PCMB. So I
correct.
had only PCB. I had
Okay.
absolutely no interest in taking up maths. So
Hmm.
that's why I went to that.
Okay.
So yes, again then NEET UG once you have gotten into your college. So MBBS is for 5.5 years. You have 4 years of studying. First year and final year are the one in which you'll be giving exams for passing and failing. Other second year, third year, they're gonna pass you like that only. Final year exams are obviously they are the most dreadful things someone will come across. Then last year is your internship. 1 year you will be working in all the different departments. That is the time most of the people decide what they want to do.
Hmm.
Then after internship, you will be giving your NEET PG exam. So in NEET PG exam, again, all these subjects, you have 18 subjects which you have studied. Those 18 subjects will be tested. This NEET PG is around of 800 marks. So again, if you have scored decently, you will be undergoing counseling where you have to choose which department you want to work in, which state, college you want to choose, and then you enter into the college. And
Um,
again, PG is for 3 years.
3 years.
So
Okay. Strictly speaking, or rather, I should say, legally speaking, in our country, is a plain MBBS allowed to prescribe psychiatric medication?
yes, they are allowed. Once you have started MBBS, you can prescribe any medicine if you want to. But I don't think so. It'll be a good idea to prescribe some medications. Yeah, okay. But if you're really dwelling into major psychiatric illnesses, then I don't think so. It's a good idea. It's always good to refer the cases.
Any, again, on this entire arduous and long academic journey, any, pointers that you would like to share in terms of, acha, these one or two things might be very useful, and avoid these one or two things?
I think when we are preparing for NEET, usually that time we are like 17, 16, 17, 18 years old. We don't really know how to go about such major exams. So finding a good teacher or a senior who can really guide you through the process can be of a major help. And I think that other day, one of the student contacted me and she said that she has been giving the exam for 4 to 5 years. She's really depressed. She doesn't know how to proceed with it. My personal experience or suggestion, I would say, is that these are just exams. Be it NEET UG, be it PG, just exams to qualify. The journey ahead is very long. It has its own struggles. If you are stuck in that exam per se, then it will be very difficult in the future. So I would suggest that maximum go for 2 to 3 attempts in my suggestion. After that, if you're not able to go ahead, there are other branches. You can do BSc, you can do BA, and you will start earning much before doctors will start earning, so you don't have to feel bad at all.
Very, very valid point. Now, but you've kind of preempted my next question, which is that not only are the exams themselves cause of a lot of distress and sleepless nights, in many cases in India, in South Asia generally, I would say that stress gets compounded by a huge, unquantifiable, almost expectation from family and society on that particular individual. What are some things in your time you might have done knowingly, consciously, or unconsciously to preserve your mental stability?
I think one thing that is very important to find out is what makes you happy. So for me is watching movies. It makes me very happy. So do it. No matter how much you have to study, how much work is it, you find your time and do what makes you happy. Another thing is having good set of friends or family. Here I have seen in my residency, I have from college also have good friends. Here I am lucky to find very good batchmates. So they really keep your mental stability. If you're frustrated, just take it out on them, shout, abuse, do whatever you want, and then you're fine, you're good to go. So I think that is very important. Talk it out, let it out. Letting out is very important.
It's funny you mention films because I know you're Bengali, and I was going to say that certainly if you watch Jolshakor, it's not going to probably make you very happy. So maybe slightly more commercial cinema would do the trick. Uh, now, because we are talking about the stress that one encounters, and we've had again very tragically a number of incidents of violence, sexual abuse, rape, etc., particularly with residents. How much do you sense that kind of fear has impacted to be doctors or resident doctors in general, broadly speaking, again, either consciously or somewhere at the back of your mind?
I think the violence part, not just I would say the sexual assault part, but violence from the family member side, from the patient's party side,
Yes.
that is something we are trained from a very early onset. That how you want to deal with, what is the amount of distance you want to maintain when you're talking to the family members. And luckily in psychiatry, you've always have guard or personnel nearby because you have patients who are very aggressive. That is a form of their illness. So in our setup, it is a little bit more easier to access. But if you go into other departments, then it might get a little difficult. So I think sometimes it doesn't matter how much precautions you are taking. If it's unlucky day, people might just say something or attack you. I have seen videos of slapping the doctors and everything. But I think one must keep it in mind that we should not get aggressive. We should not say something because later this will be taken to the court of law, and there you should have evidences to defend yourself, and then justice will be done. So yeah, that because obviously we also get very angry when someone is abusing us. So we have to really control ourselves at that point.
Absolutely. No, that's understandable. And what, one hears of these instances across the country. It's not just specific to one geography or one community. Another huge irony, and I hope our sort of research is correct, is that the most number of attempts and suicides tend to be amongst people who are studying psychiatry. Is that accurate?
I don't know. I'm not sure if that is
Okay, well,
them. It's
let's
very heartbreaking to hear
even
if
if we
that's
don't do a countdown of it, there are a fair few.
definitely,
Um,
definitely.
why do you think that's the case?
I think because of the type of, see, everyone will have their set of trauma in
Of
life.
course.
So now everyone is in their way trying to deal with it. So when you are coming across a person on the other side of the table whose set of trauma is very similar to you and kind of start resonating with that, and if you're not able to set a clear boundary that, okay, this is the patient, I have to have a very professional relationship, then it can get difficult to manage your own feelings along with your patient's feelings. So at that point, if it's like a adding summing of effect, and if you're not able to manage, you can take the other unwanted steps. So I have seen that happen, not like somebody has committed suicide or anything, but that causing a little difficulty in having, in undergoing therapies and all. So the best practice, what our seniors told us, that just refer the case to someone else. Take
Hmm.
your time. It's okay if you're not able to see that patient. It's
Correct.
not your fault. And yes, many of our colleagues or our seniors, I have seen them taking up antidepressants, medications, dealing with their illnesses. So that's absolutely fine if you have to take your own medication. It's not a, like, it's not going to hamper your professional career. Once you've dealt with it, you can go ahead in life.
Wonderful. I think it's important to conclude on a positive note. I would love for you to share with me and with everybody else a little bit about your own YouTube channel, what you're trying to do with it, what it's called, because I think more and more people should go watch.
So my YouTube channel is by the name Psychic Vlogging. So basically, I started it because when I was searching for psychiatry colleges and like psychiatry residents, I couldn't find many channels on YouTube. So when I came in the field, I thought I'll try to educate and tell people about it, how my residency life is. And later on, what in the future I have it in mind is that just try to psycho-educate people regarding the challenges I see in patients, or sometimes a patient come and tell me, and people might resonate with it even if they're not able to tell someone. So if I'm able to spread that awareness, spread that knowledge, I think it can be of help in the future as well.
Absolutely. Of course, what you may discuss down the line in terms of patient interventions will be valuable. But I think what's to me even more significant is the fact that, as you very rightly said, there's pretty much nobody and no resource who's currently studying the subject at your stage, who also is a source of information relating to your studies, your life, what you're going through, etc. And I think that's very, very significant, and which is what I was really sort of captivated by when I came across your profile. So I would encourage all our viewers and listeners and watchers to go check out Dr. Sonanki's YouTube channel. It's really, really useful, but in a very sort of non preachy way. So that's a wonderful sort of task, additional task you're performing. I don't know how you find the mental capacity or the physical time to do this along with your studies, but kudos to you. And thank you very much for what's been an extremely insightful conversation. I'm sure people will derive a lot of information from it. I certainly have. And we wish you the very, very best
Thank
in
you.
your studies ahead and subsequent career.
Thank you.